Awesome. So I'm going to share my screen and we're going to talk a little bit about our agenda for the day. And then we're going to do an awful lot of discussion and, pulling things apart today and talking a little bit about where we've gone so far. So let's see if this works. Can folks see my screen? Is that great? All right, so today's agenda really is going to be to review our logic model. We spent a lot of time at the retreat just narrowing down everything. I think people remember like all those sticky notes added up to be literally one sheet of paper now after all that deliberation. Then we did an activity a little bit a while ago with the coalition and with the coalition staff where we just started talking about what our current activities were and what we do as a coalition. So I put as many of those from your core activities worksheet into the very beginnings of an action plan, like literally the very beginnings. But today we're going to talk about like what items don't necessarily match up with our logic model, and then kind of evaluate if they're worth keeping. And when I talk about don't match up with our logic model, some of the items that that you will end up keeping are items that just are like maintenance of the coalition. So that whole strategic prevention framework part where you're always doing, and I just want to see a show of hands. Are people familiar with the strategic prevention framework? Like, have people heard of that? The big circle with all the. All right, I'll show you a picture of what it looks like so that you just have an idea of what that looks like. Let me just pull it up. Framework. I just want to show you the picture because I feel like that would help you a little bit more. I'm going to borrow it from a different one because I have a really pretty slide in there. So the strategic prevention framework is this. I'm going to do it on Google. It's this little circle-y thing that looks like this. This little thing right here. This little circle. I think you all can see that, right? Where your coalition's always doing assessment. You're always building capacity. You're always planning on what you're going to do and changing that plan up a little bit. You're always implementing the plan and you're always evaluating what you did. So that little piece, that little circle, like those are some items that you're always going to be doing. They might not necessarily match up per se with your logic model, but those are needed for the general maintenance of your coalition. Does that make sense to folks? Awesome. All right, so we'll go back to our share screen now. And our first part, we're going to review what we did last time in our logic model. So we took all the sticky notes, we put it into a paper. So it kind of looks like this now. We identified our two substances, and this is like the version without all the statistics, just for easy reference. I'll show you the statistic version in a moment. So we identified youth are using alcohol and youth are using cannabis, marijuana in our community. Those are the two big things. Doesn't mean there other things aren't happening. We know that like vaping is an issue with nicotine. We know that there's some concern around like other drugs, different things. But when we thought about as a coalition, what are the two big things we want to focus on right now? This is what we narrowed it down to as a group. Then we identified what we call the root causes or risk factors. Sometimes people call these intervening variables, all the same kind of thing. We identified that parent attitudes and social access is one of the reasons why youth are using alcohol, one of the big reasons. And then community attitudes. When it came down to cannabis, marijuana, we identified that youth were using for stress and mental health. We talked a little bit, did the chicken come before the egg? Are you using marijuana because they have stress and mental health, or do they have mental health and stress because they're using marijuana? Like, both of those are tied in with each other. And then we talked about parent attitudes. And we kind of talked about like this lack of understanding of risk, but like one of the things that came out of that too is like parents feeling like confused, like how do I talk about marijuana with my child now that it's legal? Like what are we saying? Like, is it a big deal? There's a lot of misinformation around there. So these are our local conditions that we found. And I'm going to go dive down a little bit more into them with some of this data. Like we put the statistics up for you. And you can all have access to these slides as well. but I want to highlight in particular these local conditions. So some of the local conditions were parents providing alcohol for youth, and then 28% of youth were obtaining alcohol from home with their parents' knowledge. And this is grades 9 through 12, by the way, if you needed the refresher. And then in the parent survey, the parents believe only 5.8% of youth in 9 through 12 were getting alcohol from home with the parents' knowledge. And then alcohol is available at home. So yes, the parents are providing, but it's also available. 29% were obtaining alcohol from home without their parents' knowledge. And then in the parent survey, 46% of parents report they actively monitor and keep track of alcohol when it's in their home, but they don't necessarily lock it up or secure it. In the focus group, parents said, one of the quotes, youth can go into any house and get alcohol. Most parents wouldn't notice some alcohol going missing. And then in the community attitudes, parents and people in the community, they believe that too many parents and caregivers in Needham ignore underage alcohol use. And we talked a little bit about like, what are some of the kind of norms of our community, and where alcohol is just seen as like, all right, if this is just what we do here, it's seen as normal, and this is how we socialize, or this is how we do things. We're just not going to really pay attention to alcohol use of youth being used. Then we dove down a little bit into talking about marijuana and cannabis. We found that parental attitudes and stress and mental health, and these are the kind of local conditions. So parents lacking information about marijuana laws and risks. So they were saying that they didn't really see it as that big of a deal because they don't know, they weren't sure. And then when parents were surveyed, they found out 72% of parents said they need more education around marijuana, CBD, and the new laws. And parents didn't necessarily know how to talk to their child about marijuana and cannabis. And then we identified for the stress and mental health piece in some of the focus groups, there's this pressure to excel in Needham. So there's pressures on youth. And there was through some of the focus groups and things that I was reading to put in this data, and some of the pieces that you were all saying, it's just when youth came back, in person from the pandemic, jumped back into, sports and doing after school clubs and doing a lot of things. And just that pressure to do everything and that it all has to be perfect. And in the parent focus group, parents were saying there's these expectations on children that are very high, and they're dialed up with a very strong focus on achievement. It's a very competitive environment for kids, and sometimes it feels like it's a rat race to be perfect. You have to have a 4.0 GPA. You have to be in sports. You have to do it all. And I know this is true just in explaining, like talking to some of the youth, getting up in the morning, going to school, having sports all day, having homework all night, then get up and have to do all that over again, and not a lot of that free time or downtime. So I wanted to share all that with everybody. And I wanted to just break it out into a kind of a group discussion real quick. Say, like, are we missing anything that we talked about? Were there any pieces that you feel like we didn't capture that you all, were like, they didn't say this piece from our discussion, like, and how are people feeling with this, logic model so far? There's no wrong answer, by the way, either, like whatever you're thinking. So I'd love to just kind of go around the virtual room. And if you are like, oh, I don't have anything, I feel like it's good, feel free to say that. So I'll toss it off and call on a few names. And if you feel like, I'm not even ready to talk yet, you can just say that as well. How about we start off with Angie, because you're on my screen first. Just what your thoughts are, and then just toss it to somebody else when you're done. Would it be helpful if I share the screen too while we're talking?
Yes.
Other people?
Sorry. Yes.
I think I thought it looked pretty good. I guess the one that I was a little bit more curious about, and I don't have anything in particular necessarily, is marijuana mental health.
Got it.
Yeah, I haven't really looked at those a lot, so I was very curious to look at those. But other than that, I think I would want to look at them before I offered an opinion.
Okay. And help me understand which piece when you're thinking marijuana mental health.
The stress, mental health, that block right there, and then under pressure to excel.
Got it.
I haven't really looked at any of the data in that terms
Yep.
of pressure to excel. So I wanted to really read those.
Right. And you want to toss it to anybody else?
You want me to pick the next person?
Yeah, go for it.
I'm gonna call on Monica because she's next in my window.
Hey, am I being heard?
Yes.
Okay, thanks. I think this is so great to have because we haven't had a logic model update like this in such a long time. So it's really helpful for me to have this blueprint and up to date. I what kind of jumped out for me is that the locking up of alcohol that available, it's the local condition of that it's available at home. That 46% of parents report they actively monitor and keep track of alcohol. Lock it up or secure it. Maybe we could get a little more insight. That statistic to me is interesting. And over at home and not monitored. It might not even be that it's not locked and it's not secure, but I wonder if it is being kept track of. I don't know. I'm just a little skeptical, but I think it's super helpful to have this. And
Oh,
go it to Maureen Callan here.
I'm still sort of absorbing it all. I've missed the last one or two because of vacation or time off, but I think it's a great, I love what I'm seeing. I think it's very, there's a lot of detail. I really like this logic model page in particular. I think it's very helpful. I don't see anything that's missing, but again, I wasn't, I had been at some meetings back in the spring, but not in the summer. So for me, it looks good, but again, I kind of wasn't an active participant over the summer.
yeah, no worries.
Let's see, who should I toss it to? Janet.
I'm not sure if you're going to be able to hear me or if I can hear you. We've got the lawnmowers going outside, so it's a little distracting. I really have nothing to add. It seems like this all makes sense. My emphasis is always on prevention. So we haven't just, I know we're going to be discussing what other preventive measures, but I think we've outlined the major problems that there are. I think the biggest one is community attitude. I think that everything hinges on what the parents are projecting as role models. And I think it all starts from there. So as long as we've said that, that pretty much covers it, I think. So thanks. Right. So let's see who hasn't done it. Vanessa, where's Vanessa? I saw her. I think Vanessa's there somewhere. Is Vanessa there? Maybe she just. Vanessa, do you want to go next?
Yeah, I'm here. Sorry. There may be a little bit of an echo because I'm with Karen.
Yeah.
Here we go.
So I don't know if y'all can hear me.
Oh, you're muted now.
I know, but I'll just
Oh.
use your microphone
Oh, okay.
because I'm sitting here. So I agree with Janet. I think a lot of the community attitude is most important. I think that maybe that's the place where we can have the biggest impact. Because then if we change the community, I feel like the parents who are providing alcohol, they feel like, oh, maybe I am the odd parent out who is providing alcohol. So they may feel a little bit more, outside of the norm. So I think changing the community attitude is great. And I'll pick, sorry.
So I think this looks great. So much information that we've absorbed over the last many meetings, it's hard to even put it all together and remember all the conversations, but I think this looks really great. Amanda, I kept trying to click on your slides, realizing that I can't click. Can you click on the alcohol one, the next one? So I thought the way this was set up was so fascinating, how in the same exact square, same little square, it says, 29% of youth obtain alcohol from home. Oh wait, which one was it? Oh, no, the first one, 28% of youth obtain alcohol from home with apparent knowledge. And then right under that, it says 5.8% of youth, parents believe only 5.8% of youth. So, I mean, the discrepancy there is incredible. And it's just so important to see that right there in the same little block. So just the way this is set up is really great and helpful and eye-opening. So thank you for putting it all together this way, but I think it looks great. And I think that was the last one,
Did we
right?
get everybody? Is there anybody missing?
I didn't weigh in, but I totally agree with,
Oh,
everything
Karen, sorry,
else
Karen, go.
said. It's a great format.
Awesome.
I have one little weigh in, if I may. Thank you, all of you, for your thoughtful comments. We can stay on the alcohol for a second. I'm very process oriented, but I'm also very goal oriented. And I like that we have specific data points under the local conditions for the alcohol logic model, because some of you who have been with us for a while, many of you have, know that measuring our impact it's a tricky thing, right? Because I've never subscribed to well, SPAN is the reason why rates of access to alcohol are going down. We can't directly say that, right, Amanda? I mean, we work very hard in that direction, but we're only one of many other influences in the community. But nonetheless, I think from a measurement standpoint, it is really nice to have these specific metrics, these data points, so that when we get the next survey out, we'll see these trends over time and that kind of thing, and they help shape our work. So with that said, if we could just look at the cannabis one for a quick moment. I was the one working with Amanda I put in the ones from the focus group here under stress and mental health and the pressure to excel. So those were taken from a 2021 set of focus groups. We did both high school students and we did high school parents. And so the only thing that concerns me about that is that there aren't really, that's qualitative data. We have quantitative data that tells us about the stress and mental health that students are reporting. But I would look to anybody's advice if we think we could identify something more specific under our local conditions that might give us, a quantitative data point. And maybe we can't, I'm not sure, but.
Yeah, like you could measure your root cause data. Like we can measure the stress, mental health, like these metrics. And we might even have to do that for a little while until we find this. But our focus groups and this is meant to help us inform how we do this piece. So we could technically put in these as our metrics that we're measuring. If that makes sense to people. Does that make sense to people? So put in the others.
So wait, how would we use those metrics in both places? Are you suggesting we use the metrics in both places?
I would say, yeah, because we were able to do that. See, like up here, when we did community attitudes, we put it in both places, that same metric.
Okay.
So you can use that, but the focus group is helping give us even further information. It's like finer details. And I was actually going to bring that up. We don't necessarily have like finer details about even we could even continue to drill down in focus groups and key informant interviews about some of the whys around this. For instance, one of the whys I found in a local community, we've just been doing some of the same work. They're finding this, parents aren't locking up their alcohol. in their community, they narrowed it down to find out that parents don't want to lock up their alcohol because they feel like it's sending a message, we don't trust you, to our youth. So that's like an even finer detail of like, why are people feeling like this message? You know, we lock up medication, we do all these other things, like why is it with alcohol that, you know, and that's a whole different like kind of way that you would go about approaching that statistic. Does that make sense? Yeah, so like this is
Can I
like the
ask
finer.
one more question?
Yeah, you can ask as many as you want.
In keeping with what you just said, Karen, we are going to do a parent survey next year at the same time that they, okay.
Yes, yes, we will.
Yeah, so we'll track these. I wanted to take a couple minutes before we jump into the last like half. Are there any questions that you're thinking, oh, we should be asking the community this in light of this data? Kind of going along even what you were just saying, Angie. Like in light of this data, what other questions do we want to make sure we're asking, or do we want to think about in focus groups, or do we want to think about in you know, some of these key informant interviews? Like, what are there any other questions that we might want to be asking the community? And we can drop those. Yeah, we can raise them up. Also drop them in the chat too as well. Janet.
So I'm big on what are people's attitudes and in terms of that, I mean, do they feel that it's absolutely hopeless, that they can't change it? I get that sense quite often. I was just at a 6-hour conference on sleep on Tuesday, and it was mostly healthcare professionals, psychology predominantly, and the feeling I came away with so often, despite all the evidence, you know, this is what you need to do, blah blah blah, it was sort of passed off in the end as, yeah, but I'm really not going to do that. So I just wonder, you know, how big a struggle is that? Because when you have a negative attitude, you cannot change a behavior in a favorable way. So it all starts with attitude. And actually, I talk about it in the book that I've written, and it starts by acceptance that you have a problem. And then you take it, and that's where I think, first of all, people are not really getting that we have a problem here.
Yeah, that makes perfect sense.
And then it goes to taking different perspectives. How might we address this? You know, looking at what we have that is working. So that's our gratitude for what does happen. I mean, we're in a very well-off community by most standards. We have a lot of resources. We have a lot of potential to make things better. So I think that's really an important piece, because I just think there is such a defeatist attitude out there about, particularly about social media and people using their computers. You know, they should turn them off an hour or at least an hour before bedtime. Everybody goes, not doing that. You know, it's just that, it's that attitude that, yeah, I know what's right, but I'm not going to do it. So, you know, I think that's an important piece to consider. I don't know exactly how we address it specifically, but I think it's huge.
No, that makes sense. And Janet, I think you're talking a little bit about too, like when we let people know that what you are doing is working, it does bring that hope, right? So as we continue to communicate out to the community, hey, numbers are declining. The things that Span is doing are working. It builds out momentum. So I think that's of note. And Angie said in the chat, we should look at the parent survey questions and see if the questions could give us more information about the logic model, respecting the need for trends over time. And I'd love it if anybody else has things that they want to say too, just feel free to keep dropping them in the chat, just in the interest of time too. Karen, I see your little hand raised. Do you have your hand?
I think that Janet's question is really key to this process, because in the time that I've been working in prevention, we've pretty much, from a prevention standpoint, we've acknowledged that changing community attitudes is a very challenging goal. Very challenging. It's that analogy we've used in the past about steering, you know, changing the direction of the big ship, you know, that it's very hard to move that rapidly. But to multiple points made in this room today, I think that we can inform and educate people in the community in a way that might shift attitudes. I know Positive Community Norms is a campaign that we've already started implementing to try to shift student attitudes and to a lesser degree their parents. But is this, Amanda, from a prevention standpoint, one of the questions we should ask in terms of capacity to change and the community's willingness and readiness for this?
Yeah, I think so. When we did our little like grid, we put up like we think we could do something in the long term about some of these. Not necessarily like every part of that. But we think we could do some, yeah. And I see that in there. I see that in the chat too. I think we're gonna narrow down to like what's a handful of things we can do right now, right? Like we're not gonna be able to change a 10-year thing in 1 year, but we can chip away at it and do something, a piece of it right now. So yeah, I think that's great, valid point. And Monica said access. Most parents wouldn't notice some alcohol going missing. Is a quote on the logic model from a focus group. I think we could get word out to monitor what alcohol you do have in your house, just like we do with prescription drugs. Please keep it away from the kids. Yeah, well said, Monica. All right, so what I'm hoping is keep dropping anything else you're thinking in the chat. Anybody who's on this call that wants to further like go look into our logic model, any of the data places that you're finding that you're like, nope, I also know this little piece could support that. Please feel free, like I'm going to make it so that this working group all gets access to that logic model and be able to comment on it and say things that we might be missing. But I'm going to just direct the back end now just to talk a little bit about kind of all the activities that you all listed. So I'm sure you all remember that big worksheet that we had. I'm going to show you a picture of it. It might scare a few people. But this big giant sheet that we all worked on, we all dumped in lots of information, right? Everybody remembers that kind of piece that we talked about. I started listing them out into a little bit of an easier, like readable space for all of us. It's a very rough draft. And I just started listing all the activities that we do. But I want us to look at our logic model and look at our activities and just say which of these activities line up with the logic model. And the way that I'm going to do it, because we can't do all the shared screens all at the same time and we're not in a room where I can just put it in front of you. I'm going to do it as I'm going to read off your activity. And then you're going to identify where it could fit on the logic model. And one of the ways that I like to do that for the logic model is I'm just going to kind of like label, I guess you could say, our logic model. So we have 1, 2, 3, 4, 4 pieces that we really are focusing on for those local conditions. And you would just let me know what local condition that activity could fit into for right now. Does that make sense? And if it doesn't fit into any of them, so let me just show you what I'm talking about. So I labeled your local, your 4 big local conditions that we narrowed down to for right now. This doesn't mean everything, but for right now, we narrowed it down to these 4. I'd read out the activity and you can say, yep, this address is number 1. Yep, this address is number 3. If we come to an activity that somebody notices it's not addressing any of these, we want to stop for a minute and talk about that. So if everybody's like, that activity, I don't know where it fits into these local conditions, we're going to pause. We're going to take a few minutes to talk about. Do people feel like they understand what we're doing? Are there any questions? All right, we got it. Thanks, Monica. I appreciate that. All right, here we go. All right.
Are you going to keep that logic? Thank you.
Yeah, I'm going to keep this up and then I'm going to try to like read off. I'm going to have to do it actually. I'm going to do it like this. I'm going to send it all to you because I'm going to be reading. So I'm going to put it in the chat. You should all be able to see this in the chat. With the link, you'll all be able to view it. So go click on the link that I just dropped in the chat and then I'll start reading. Everybody see that link? Go on over. All right, let me know if you can't find it for any reason. And I'm going to start reading them off. All right, give me a thumbs up when you're ready for me to read. All right, hooray. All right, so write down if you see it and stop and pause and say, Amanda, that doesn't fit. Just shout it out if you see it. All right, number 1. Our activity is hidden in plain sight. Then just stop me if I got it, if you don't have it. Number 2, a parent training. It didn't say what kind of parent training, but parent training. Could that address any of these 4? Number 3, an overdose awareness vigil.
Amanda, can I have you pause for 1 second?
Yes.
So you're just clarification. What you're saying, we need to decide if it fits into which number of these local conditions.
Yes, or fits into any of them. So I'm gonna make a guess. I'm guessing that our overdose awareness vigil might not fit into any of these local conditions. Am I right to say that it's not really fitting? Now, does that mean we're not going to do an overdose awareness vigil? No, but it means that we're going to talk about it as a group and say, is this addressing our overall local conditions? Do we want to keep that for right now? And I'll show you kind of like where. So does our overdose awareness vigil address parents providing alcohol for youth? Not really. Does it address alcohol use being ignored by people in Needham? Not really. Does it address youth using to cope with stress? Nope. And does it address lacking of understanding of risk? It doesn't really address any of these.
I think it sort of does the last one.
Okay. And help me understand. That's exactly why we're doing this. Help us understand why, Janet.
Well, actually 3 and 4, because we are I think the fact that people have overdosed is a sign that there's a real problem, and that we see too late. So it's understanding that there really is a risk there, is the fact that they actually committed suicide, or whatever. And I think that the stress part certainly comes up. I mean, I'm thinking of Deb Schmill's presentation and her story of her daughter, and that certainly it brought to light both the risks and the stress that the child was under that led to her horrible journey. So yeah, I think it fits in, but that's me.
No, and I think that's great. I think you would actually put that into your action plan. Like, how are we being intentional about our overdose awareness vigil to make sure that we're talking about what you just said, the stress, right?
Mhm.
And the risk, like how did alcohol or marijuana play a part in this story? Right? So in talking about this, we're making sure that we're not just doing an overdose awareness vigil because it's a good thing to do, which it is. We're also being very intentional about that vigil addressing our local causes and root causes. Does that make sense?
Can we go back to the other two, the hidden in plain sight and I didn't catch what the second was because I wasn't yet on the right page.
Oh, it's okay. Yeah, so the ones we talked about so far, as we talked about hidden in plain sight, and everybody felt like, yep, that does.
So do we want to actually be saying which numbers these fit in, or?
Yeah, so right now we just want to identify, do they fit? Because we're going to keep everything that fits right now. In the future, we'll tie them right back to those actual root causes. But for today, because we only have half an hour to do this piece, we just want to start talking about anything that might not fit and talking about, do we want to keep doing that?
Okay, because I was thinking it helps to see which one it fits into, then we can see which ones we don't have enough of or whatever.
Yeah, I definitely like that will be a next piece. Like we'll send that out. Like I'll start matching all those pieces up of the ones we left. You know what I mean? But I just wanted to make sure that today, because it would take more than 20 minutes to do all that piece.
So what was the second one? I've still lost it.
Yeah, well, it's okay. So our second one, we had hidden in plain sight.
Parent training.
Then we had a parent training. And then we have an overdose awareness vigil.
Okay.
And these are all the ones that you guys are working on by opening up like your little screen. So far we said yes for hidden in plain sight, yes for parent training, yes for overdose of awareness, and we need to be intentional about tying to root causes. All right, the next piece is our monthly coalition meetings, which we know that that does work. Our drug take back days. Anybody want to talk about any of those drug take back days? Do we feel like that ties in? Awesome, people are nodding heads. Okay. The next one is our educational events.
Yeah, that's really good.
Education. A harvest fair, and we didn't necessarily say what we're doing at some of these events. So talking like, how do we tie in something like a harvest fair to be intentional about our events? An open house. It says Cath open house, CATH. Not sure what it is, but
That one I'd be kind of like, it's targeting the older adult population, not parents.
all right.
I don't know. I think we could use the same argument as the overdose awareness day, but I think we're pulling back a little bit far now.
Yep.
Like
Well-
now we're educating grandparents.
Could that
But-
be used where the community attitudes are?
Mm, absolutely. And remember, there's a huge it's a sort of a there are a lot of older people who are closet drinkers, and it's a major problem in our
Agree, but we
society.
don't work on that in this.
Yeah, so
But
yeah,
it is a community, it's a community norm. So, if the kids go and visit grandma and they smell alcohol in their breath, they start, oh, it's okay for grandma to do that. It's part of the community norm, I think.
but it might be like one of the items that's not the highest on your list.
That could be.
You guys are doing a very lot. Like I started
And it
reading-
doesn't fit into any of the local conditions that we're talking about, right? I mean, and I had that same question about the drug take back. Where does that fit into the local conditions? I'm not clear on
of
that.
this question. What do you want?
Well, I would say the drug take back, I put that one under lack of understanding of risk. And we don't have, and I would say access, like
Access.
parents providing alcohol and stuff. Because in the drug take back, it's like educating people not to have things in their house they don't want,
Right.
substances.
Okay.
Okay.
And monitoring their
Yeah.
Maybe
medication.
that's a place where you put that. Maybe you add to the drug take back day something that goes out about monitoring your alcohol. Like that would make it tie back in. Right, so that when you do the take back day, this information is also going with that. But it's like an extra link you'd have to make. Do you know what I mean? So that might be something where you're like, this is important. And you might say to the coalition, this doesn't take an awful lot of effort out of the members. Like I know in one community, they have a take back box. It's not an extra effort. Like there's not a lot of extra things that the coalition has to do. But if this is something that's taking a lot of your effort, you might want to say this might not be the thing that we most want to focus on right now. So I think that's worth saying, sorry.
I would say too, we did look into, which maybe we need to really like make this an actionable step. We looked into collecting vape pens. So if we could actually collect like vape pens that are used for cannabis, we could directly like.
All right, I'm putting that in. Perfect. All right. Our opiate awareness day. Anybody have any thoughts about that one?
I think
It's
that sounds
separate
like
from
the
the vigil. Yeah, I think that's the vigil.
Yeah, I think so too.
Perfect. And then somebody said event at Rosemary Pool. I'm not sure what that is, but
That was tabling, I think, at Rosemary Pool. That's what I'm thinking that is. Where we went out there with like info for younger parents.
so keep that. All right, and then we have next. All right, so those are all the events that you all do. The next part is some presentations. So an annual presentation for the steering committee. This would be like around like your data and things like that, right? Like you're tracking your logic model. An annual presentation for town boards. Has like different boards that are listed. And you have an annual presentation for your coaches.
Yeah.
So those presentations, you just have to make sure that you're making sure that they're impacting those local conditions. Like you're not just doing a presentation for presentation's sake, but you're doing it around those conditions. So we're going to be intentional. All right, and then we have some media campaigns. We have the Rethinking Success campaign, and that is very clear that it ties in. It said talk campaign, and I'm not sure if that was talk to hear you or something like that, or just talk.
It was a parent action team project called Talk About Life with Your Kids, and that's where the abbreviation comes from. So it was a social media campaign to help provide parents with conversational skills and communication techniques.
Perfect.
Mm-hmm.
And then you have a social norms campaign, and that social norms campaign is affecting the way that people are thinking about misperceptions.
Right.
All right, and then we have some trainings, and some of these trainings are internal and some of them are external. So I'll kind of put those out there. You have a vaping training. Anybody's thoughts around that?
What is that exactly?
I wonder if that's the cessation program. Does anybody know who may have put that, person who might have been thinking about that?
The one through Youth and Family Services? Is that
Yeah, it didn't say, just said us vaping training. So it was
Okay.
good.
like a how-to?
I didn't put it on, but I'm assuming it has to do with how we trained all the nurses.
Yeah,
But we had the vaping grant a couple of years ago.
The
It's
cessation
not
program.
something we do every year, right? The cessation program training.
Perfect, you're not done now. Then we have our hidden in plain sight, not just the presentation, but the training that comes along with it. We have our tips training. Tips is the one, like, okay, I see we're nodding their head. Then we have our DEI trainings. And I love to ask, like, to make our piece, like this is part of what you would call your coalition, like maintenance part, right? Because you're wanting to make sure you're doing your programs and your strategies in the most effective way for your community. So that would stay as like your coalition maintenance, even if you didn't tie it directly back to a specific piece. Like you want to keep those things in. You have a CADCA. These are like some of your internal trainings now for like your staff. You have a training at something called CADCA, which is where your staff are learning like best practices, and maybe some coalition members sometimes attend that. You have what we call PTTC trainings, also an internal. That's like a national trainings as well that are helping your staff stay on top of practices. And then you have your state trainings, and that's through the Bureau of Substance Addiction Services. So those like 3 trainings don't necessarily tie back to like a specific thing we're doing, but it's like that coalition maintenance and making sure your staff are like constantly getting best information about how to do prevention work. All right, our next part is our data collection. And so this is part of what we were saying, like these are things that you're going to regularly do in order for coalition maintenance. So we're going to leave all of these in your action plan unless somebody pushes back on me and says, no, they shouldn't stay. The first are annual collection of key informant interviews. Our community indicator data, and that's like data around like calls for service from law enforcement, or maybe like your admissions for treatment information, those community indicator data. You guys do a parent survey. You do focus groups. And then biannually, you do a survey with all of your youth, the Metro West Adolescent Health Survey. So those are all helping you decide, like continually stay on, are we being effective in what we're doing? So those are like coalition like maintenance pieces. The other 2 big pieces you had on your action plan is you have a group of people who are doing some alcohol policy, it said. I just wrote alcohol policy. So group. And then you have a group, it just said under like policy and advocacy, a mental health policy advocacy kind of team that's together or group. Are there any activities, initiatives, or anything on here that we're missing? I took it off from that big giant list. Was there anything that you're thinking, oh, she never mentioned that? And we do that. And feel free to just like shout it out. Oop. Anything that we might be missing? Yeah, Karen.
Maybe under trainings, be coalition training. We have brought in speakers and tried to do some training around prevention training for coalition members.
Love it, like a prevention 101 kind of things.
Yes.
Okay.
Good.
Yay.
What about salsa? They have an annual like peer leadership.
Yep.
Well, not only that, but Karen Mullen, isn't there a training even this weekend?
There is.
That's
I was
annual.
going to say we train our youth. FCD comes in annual and trains our new salsa members and teaches them basics, prevention 101, and more importantly, how to communicate that in a peer-to-peer model when they go into the middle school.
Perfect.
But that isn't something this group is less, we're not as likely to be able to weigh in on whether that should be kept or not, because it's funded separately. For example, you know what I mean?
But it might be still part of all your overall like
It
span,
is.
because
Yes.
you're like are there ways that like what I heard from your coalition is kind of like it's always been like kind of separate from the coalition, but is there a way to bring those things a little bit closer together, because you have access to an awful lot of youth who can inform an awful lot of what you do in your community. And like anytime you have ability for youth to lead, you know, they're a place where people are going to listen. Like people are very apt to listen to what young people are having to say. And so engaging them in some of this. And I mean, they're the ones also who gave the data to say, this is what our problem is, right? So bringing that back to them to say, hey, this is what you all identified, you know, what are your thoughts around that? I think it's a really powerful connection to pull them closer together.
Absolutely.
I don't know. I see Karen, you're nodding your head. Did you have something you wanted to add?
Oh, me?
Yeah.
Yeah, it totally makes sense. In terms of the funding, yes, we're sort of separate, but you're right. It's a group of kids that have amazing ideas, and we've got data both from youth and parents. So maybe there's a way to, I don't know what it is, because we're doing some of it right now, but I definitely agree that there are ways to sort of leverage that.
And be like a little more intentional about everything that we're all doing together. And I know to Stop Act 2 is also kind of like a little separate fund bucket too, but like looking at that as well, like how can they be addressing like your root causes as well? And what do those things look like in your local conditions? So I want to pull it back because we have 6 whole minutes left. So I want to talk a little bit about like next steps for this piece. We identified on our list 2 items that we're going to probably have to talk a little bit more about, like whether we want to be like how we're going to be intentional about them in order to stay on the list. And then I put together kind of for all you as homework, we talked a little bit about where those were on the 7 strategies for change. I think you guys would probably remember like the handout we sent with that. I'll include it in like a link for you all to review. And a lot of you identified which ones of these fit into those 7 strategies. And we noticed that we have an awful lot of 1 strategies in our community. So we have a lot of education happening, a very lot. But we don't necessarily have a whole lot of strategies around reducing barriers or increasing access to things that are like positive. We want to be able to talk about some of those. So I'd say like we call them strategies 4 through 7. those are the strategies that you're going to read on the list that are a little harder to do in your community. But if we don't put a mix of those in there, the sustainability piece won't necessarily be there. So education, you have to consistently do it all the time, right? We're always educating on it. But like when it comes to something like policy change, we change a policy, you can't smoke inside, right? That's like a permanent long-term thing. It took a long time to get to that thing, but now that's something that's sustainable in your community and it's going to stay. So your community is very top heavy on the education, providing skills, like the beginning part of those 7 strategies, but our coalition's a little weak on the other side where it's like some of those sustainable pieces. So we're going to identify some of those pieces and talk a little bit about that. We're going to be meeting again in the near future to talk about what are some things we could be doing in the community to add to those 4 through 7. So I'll put all this together in kind of like a homework sheet for, I guess, all of us to keep on doing this work. We were able to pull out 2 things that we need to be more intentional about. We might even end up passing in the future. We don't know, or changing in the future what those look like. But I'd say like great work. And I want to turn it back over to Karen for like any questions, anything like that for next meeting dates. And I'll be putting together kind of your homework sheet for all of you.
Thank you, Amanda. I see we have a minute here, so I'll just be brief. I appreciate all of the thought that you shared for this working meeting, and our plan is to come together for our quarterly meeting on October 12th. It's a Thursday in the evening in person. That's our hope. And actually, we're going to offer a hybrid option too, but that meeting will be an opportunity to really share out where we are with all of this strategic planning. And thanks to your help, we've put together a tremendous amount of it. And thanks to Amanda for really leading the charge on this. We couldn't have done it without you. So we hope that people will be able to come on October 12th to really kind of hear and see the full picture on this as far as we've gotten, and then also provide feedback and input at that time as well. So our plans we're moving forward. This takes a lot of process and planning. So again, Amanda, thank you. Getting our heads around this is hard to do alone, so we are grateful. Did I miss anything, anybody?
Any questions people might have?
Because I think too, we would like to at that meeting talk about action team structure, because that would be the next thing. Like, how do we get moving now? How do we move forward with getting some of this work prioritized through action teams?
Mm-hmm. And I think of note, Karen, like so far in all your discussion, the group has kind of said like the way that it's structured right now, like if we're going to continue to move forward and be more intentional, we definitely need a different structure.
So, thank you. Well, thank you, everybody. Feel free to shoot me any questions, or if you have any thoughts about this after the fact. And Amanda, are we going to share the logic model with everybody? I can use the links that you have too.
Yeah, so we're going to share the logic model, and we're going to also share the action plan. In the action plan, I started putting down like where some of those connections are, like those numbers, as we were talking. And I'll give out some like kind of homework next steps for people. So keep your eye on your inbox between now and our next meeting, because there'll be a little bit of homework that you could all help with and dive in if you want to.
Great. Thank you, Amanda. Thank you. Thank you. Thank you, everybody.
Thank
I
you.
hope you have a good rest of the day.
Thank you.
Everybody.
And we will see you soon. Thank you very much for coming, Janet, Sari, and Maureen.
Thank you.
Of course, our team. Thank
Sure.
you.
Okay, bye now.
Bye.
Bye.
Bye-bye.